who have already been tested for coronavirus, like with negative results, have received medical bills exceeding $3,000 a day. And a healthcare system that leaves Americans unable to afford coronavirus costs could cause personal bankruptcy, and the coronavirus pandemic continue to explode in the United States, as we see in nowadays report.
Canada is an immigration country, which means that a large proportion of its population is composed by the immigrants. Maybe they're not Canadian citizens now, but they will be in 5 to 10 years.
And the waiting list in the public healthcare system might be a little long, but as I have mentioned in my rebuttal as well, it will not endanger anyone's life, so this shouldn't be a problem. It is unacceptable if the poor people if everyone have to pay in order to get care, because again, the responsibility of the government is to ensure that the basic human right of their citizen is protected.
Yes.
Wouldn't you agree that if a monopoly were to occur, that would stifle innovation and drive up prices?
I believe that capitalism breeds innovation, and in this case, a monopoly will most certainly be broken down and or will have to innovate even more in order to maintain that monopoly.
Private healthcare actually might compromise individual safety, as many people have brought up that it could be safer. These insurance companies also want money. It's not only the government that wants to save money, but it's also the insurance companies that want to save money. So these cheap alternatives, they may harm these people, as these insurance companies, they aren't part of the government. They don't have any incentive to keep these people as safe as possible. But you would like to disagree.
So you continue to talk about putting more financial resources into better organization. Now I'd like to ask you, where would you be getting these financial resources?
These financial resources would be taken from the funds that the government already has, or the funds from places inside the hospitals that are if they're disorganized and they may be wasting the funds. If we organize this, we can get funds from somewhere else that was maybe wasting the funds that we currently already had.
Canadian taxes range about from 15% to 33%, and in the United States, they range on average between 10 to 22%. We don't want our taxpayers to feel even more burden, or for our governments cut even more things from like education to fund these more organizations.
The first definition of their model was to give poor people money directly instead of giving it to hospitals and having free healthcare for the elderly. Now, let me tell you why this model, first of all, doesn't work, and all their later revised models don't work either. Now, how do you define poor people? Do you define poor people as the homeless ones living on the streets without any money in their pockets and no home to go to? Or do you define poor people as the 76% of Canadian families that have to work from paycheck to paycheck?